Welcome and thank you for joining us today to participate in our inaugural think tank and open forum. My name is Dr. Deborah Weisfuse, and as president of the Alliance for Oral Health Across Borders, it is my pleasure to briefly introduce both our organization and our distinguished speaker to you. First, many thanks to our business manager, Jamie Peroskin, who has helped with the many details of this meeting and is running our Zoom room today. Next, please. The Alliance for Oral Health Across Borders is a global health organization created in 2011, composed of academic institutions, corporations, and independent healthcare professionals, all working together to improve quality of life with a special focus on the burden of oral disease. The reference to borders in our name underscores that we are especially interested in addressing any issue or concept that acts as a barrier to expansion of quality oral health care. Our members leverage their collective experience to mentor, network, and problem solve with similar leaders in other countries. Next. Next slide. We share best practices and promote successful, scalable projects that help achieve our goal of seeing a reduced burden of oral disease, especially in underserved populations. Next. We have a special interest in strengthening existing leaders and training students in leadership concepts to lead in the future. Next. Many thanks to our sponsor, the Edward B. Shills Entrepreneurial Fund, whose vision is to recognize, develop, and connect healthcare leadership to innovate systems for the social good. Next. With this new Alliance initiative, we hope to building a cutting-edge community of like-minded leaders interested in sharing idea and innovation. We hope to prevent all from having to reinvent the wheel by sharing our best practices. We hope to attract a diverse group of organizations whose missions overlap and find that connection with our organization expands their capacity. And we hope to serve as a resource for a multi-generational group of professionals interested in more effective public health leadership globally. Next. Now it is my pleasure to introduce the presenter of our inaugural think tank and open forum. Dr. Judith Lasker is Professor Emerita of Sociology and Health Medicine at Lehigh University. She earned her BA at Brandeis University and her PhD at Harvard University. She is author of Hoping to Help: The Promises and Pitfalls of Global Health Volunteering. Dr. Lasker is co-founder of the Advocacy for Global Health Partnerships, a coalition of groups and individuals working to improve the ethics and effectiveness of short-term volunteer and training activities in global health. Dr. Lasker is the creator of the Brochure Declaration, which is the result of her years of research into the topic of improving the value of short-term clinical programs in global health. This declaration is a statement of ethical principles for guiding policy on these initiatives, and it has already been endorsed by many global health organizations. In 2014, she was awarded the Centennial Medal by the Graduate School of Arts and Sciences at Harvard for her contributions to society emerging from her graduate education at Harvard. Congratulations. I'm now proud to hand over the baton to our presenter, Dr. Judith Lasker.
It sounds extreme, but.
Okay, somebody's here. Thank you very much. I'm gonna just want to make sure the technology works. Thank you so much, Deb, and I'm really grateful to have been invited to be the first in what I'm sure will be a wonderful series of think tanks. I'm especially honored to be invited to speak with a group of very distinguished leaders in oral health, and to be sponsored by an organization whose values are based on bridging gaps among people and advocating for health equity. So values that I care a lot about. So I'm really happy and excited to be here. And I know for some of you, it's very early in the morning and for others late at night. So thank you for being here. So I'll go quickly to giving you an overview of the work that I've been doing, the questions that I've been thinking about. And I know that some of you have sent in questions, so I look forward to having some discussion as soon as I can advance my slide. There we go. Okay, so you know better than I do that this past decade has really been an exciting one for oral health, and some of you have been instrumental in making that happen. Journal of Dental Education wrote an editorial back in 2013 calling global health and dental education being at a tipping point. And last year, The Lancet talked about oral health being at a tipping point. And then just last month, the WHO adopted what the Secretary General called a landmark resolution on oral health. So it's been a very exciting decade, and I'm grateful to those of you who have led in this effort. For me, the topic that I'm going to focus on is just a very small piece of that, is the role of short-term global activities. It's something that is very frequent. Many of you have been parts of short-term dental trips, oral health programs. I thank you to Brianna, who's on this call, for letting me know about the ADA database, which right now basically doesn't have anything in terms of information about trips because of the current situation. But ordinarily, in what she called a normal year, hundreds of dental organizations go on trips overseas on short-term dental programs, and thousands of dentists. And this is just mainly from the US. If you multiply it by around the world, you can see that it's actually a very large enterprise. But that's a normal year. This is not a normal year. And I always have to ask myself when I'm thinking and talking about short-term global health, you know, right now we're in this worldwide pandemic. The world is in a disastrous situation. What's the deal? You know, why is short-term programming to really pay attention to when there's so much else that demands the world's attention? Because of COVID, these trips that I've been studying have basically stopped. There's almost no short-term trips in global health right now. And almost every country has shifted the priority to fighting the pandemic. So in that situation, however, a lot of people are beginning to say, this is also an opportunity. As tragic and horrible as it has been, it's a chance to step back for a minute and think about, what have we been doing? Can we do it better when the day comes that we can start again? So the challenges I want to talk about today are really twofold. One is understanding what the problems are, what they have been, and thinking about how to reboot, how to make changes. So the first one is understanding what the problems are. There has been a growing debate in the world of global health about short-term trips. Should we have them? Shouldn't we have them? What are the good parts? What are the bad parts? And I just want to review really quickly, and I'm sure many of you are aware of this, that on the one hand, they are an enterprise, a set of activities that have gotten a lot of support and attention for good reasons. It's a chance to bring services and help to people in underserved populations in places where the needs are great and where volunteers or students can offer some help. And it's very valuable for those volunteers and students to learn more about the world. So it's clear that there are many advantages and many positive outcomes from short-term volunteer trips. On the other hand, they've been increasingly criticized, and I'll talk a little bit about that in a few minutes. The new colonialism, they've been called, the white savior industrial complex. And some of the very specific criticisms have to do with fostering dependency, providing unwanted services, or even causing harm. And very specifically for those of you involved in the academic pursuits, a lot of times students um, see these opportunities as a way to get experience they could not get in America. And they're even advertised sometimes that way. Come with us overseas and you can do stuff that you wouldn't be allowed to do in America, and you can gain experience that'll help you get into graduate school, etc. So there's been a lot of criticism of that because of people without training working um, in healthcare. So controversy, what do we know about the reality of the pros and cons? What research is there? And the reality is, and this is how I got started on this. I had a lot of students doing these kind of trips. I was teaching global health at Lehigh University for many years. And so a lot of my students would go off for a week or two and come back and say, wow, I had the most amazing experience. But I don't know if it did any good. That was my students who prompted me to begin to look at that and say, okay, what do we know? What does the research tell us about whether these are valuable for the students or they're valuable for the communities that they are presumed to serve? And what I found very quickly is that there is almost no evaluation of a serious long-term type. And I have this little note here that said counting the number of patients or how many toothbrushes are distributed. It's good, it needs to be done. You need to count what you've done, but it doesn't really tell us about the impact. So I started this a number of years ago, and I have to say that even after looking at this literature and studying this for quite a while, we still have very little in the way of good evaluation of the impact of short-term global health projects on either the volunteers or the communities. It's kind of amazing. So anybody out there looking for a research project, I would be glad to talk with you. So I did do some research on this, and actually I've been doing this for now almost a decade, with a lot of help from Lehigh University's support, and also working together with Catholic Health Association, their international office, and in combination, we did, as you can see, a whole lot of surveys and interviews with people in the US who were sponsoring trips, and then surveys and interviews with people in host countries who host the volunteers or students, some participant observation. And then after that study, those two studies, we're in the midst of one now where the same research or similar research is being done by people from the countries rather than an outsider like me going into a country and saying, so what do you think of outsiders coming to your country? We're having researchers in those countries ask the questions and actually design the interviews. So lots and lots of data, and I'm going to just give you a couple of brief results. When you ask hosts what they gain, what are the benefits and advantages of having volunteers or students come for a short time, there's a lot of positives. Some of the things I mentioned before as pros. They're very happy to have care going into underserved areas where people don't have regular source of care or it's very under-equipped. Sometimes the volunteers and the students bring money that helps the institutions to add to their infrastructure. When there's training, they're especially happy with that. Sometimes just having extra people to help out. So there's a lot of positive things, as well as the non-health benefits. Very often when I ask people, so what are the benefits? They would say, well, mostly they come and they're tourists and they spend money and they buy souvenirs and they stay in our hotels and eat at our restaurants. That's good for the economy. And it's good to know there are people out in the world who are interested in what's going on here. So there's a lot of benefits that a host can see. And those of you who've worked in these programs, I'm sure have heard a lot of this firsthand. But I want to talk a little bit more about the drawbacks because that's really more controversial and more problematic. Many times I have come across examples of and heard examples from hosts about the need for language and cultural awareness. One of my most sort of cringeworthy moments in accompanying a group of volunteers in Ecuador was we, as these trips often do, got up early in the morning, packed up the buses with lots of supplies, rode off into the, you know, rural area to a small town, almost a village, and then all of these folks quickly and energetically and with lots of enthusiasm unloading the buses and trucks and taking all this stuff inside the community center to set up a clinic for the day. I'm sure some of you have seen this kind of thing. And standing at the door of this community center was a man, nicely dressed, and saying something to all of us as we walked in. And everybody just walked by him. They had no idea who he was or what he was saying. And as it turns out, he was the mayor of this town and he was greeting us in the local language. And the fact that nobody knew that and nobody knew how to respond to him was just really uncomfortable and really unpleasant. And that's just one example. But when we've done the research and asked people systematically, what do you want the volunteers to know? They want them to know something about the history of their country and be able to have some basics in language that they can communicate with. Even just greetings would be really useful. So, and there are a lot of other examples of sort of cultural insensitivity that people cited. Another big issue is oftentimes groups go to poor countries with the assumption that they don't have anything. And that assumption drives the notion that even if I don't have anything in the way of skills, well, I'm an educated person, I could surely offer more than what they have there. They don't have anything, so I can offer something. Besides the hubris that is involved with that, the reality is that in a lot of places there are local services, there are local professionals, and oftentimes the visitors don't even know it. And a serious problem is that if a group of people come from the outside with free services, local professionals, dentists, doctors, nurses, and so forth, who may be making their living, who often are making a living from their services, are sometimes pushed out of business. And that has definitely happened and is a serious problem. Generally, a lack of respect for local expertise was cited by many people. Many of the studies, that is one of the key things, is that again, the volunteers or the students, again, assume that the people they're working with don't know very much. And in fact, they often know a lot more than the visitors. And they certainly know the problems and ways of solving those problems that are creative, using few resources, and that there's a great deal that they the visitors. Very often groups arrive with little input from hosts. Partnerships are lacking, it's a real problem, and oftentimes these are one-off trips with no follow-up, no sustainability, and they sometimes create extra work. And finally, lack of oversight. There's no coordination. Groups all, you may have 3 groups that show up in the same village and have no idea that another group was there last week. So these are many of the problems that we came across. Coming from that, the book runs through 9 recommendations. Primarily run by women, not women's work. I can't go through all of them, but you can read them quickly, and I'm going to come back with some of the principles in the brochure declaration that build on these initial recommendations. But you can see just reading through it that we emerge out of the critique that I just talked about. I just want to point out one of them, number 6, because this is particularly of interest to people in oral health. One of the things that I observed going on a couple of these trips is that people would sometimes come to a clinic, with visitors, and the problems they had were eye care, or they were oral care. They had terrible toothache, or they had problems that were related to oral health. And essentially the volunteers had to say, you know, we can't help you. We don't have the capacity to do that. But sometimes another group would come, you know, a couple of weeks later. And if you're talking about people having to travel for a long distance and take time off from work to see a clinic, obviously there's some real value to trying to coordinate the different types of health services into one kind of into a unified program. But as you know very well, we don't do this in the United States or in most other countries. The lack of integration is a serious challenge to having good comprehensive health care everywhere. So, and the problem that that raises is the one of silos. And this is what I am especially interested in, is that people working in the global health area are very much divided by silos. So the first one being by the disciplines. So just what I mentioned, you know, the programs are organized separately. There's a few programs that do bring together dental and medical and nursing professionals, but that would be the exception. There's also silos in terms of who's sponsoring the organization. So many of them are sponsored by faith-based groups. They might be local churches, small groups that go occasionally. They might be large church organizations. There are also many NGOs that are not based in church organizations. There are many academic programs. There are companies, both you know, profit-making organizations that do voluntourism, but also many large companies who have a health interest and who they send some of their employees on trips. And then finally, the silos of sending countries and host countries. So it's really, I think, one of the things that I have been most interested in my work is how do we bridge those silos? So I'm going to get back to that, but I also want to say, you know, we've talked about the change in oral health over the last decade. I also want to say something about changes in what has happened with global health and with short-term programs in particular. One is we have a tremendous increase in popularity, at the same time growing criticism, some reevaluation of programs, more guidelines, some action on the part of host countries, and then finally, we're going to talk about the work of the advocacy for global health partnerships. So it's a lot of stuff, but I'll go through it quickly, and I hope we'll have time for discussion. So the growing in popularity, we can see it certainly in the studies of dental schools, the increase in schools that are offering global health programming, both curricular and in terms of experiences abroad, the number of dental students who want to go on service trips or have gone on them. At the same time, we see this growth in the for-profit voluntourism industry. And very interesting to me is the growth of South-South programs. I gave a talk a couple of years ago in Ghana to an organization called AfriHealth, African Forum for Research and Education. I may have gotten that wrong, I'm sorry. And I talked about some of these findings, and one of the people who responded said, why is it always north-south? Why is it the assumption that all volunteering goes from north to south? What about south-north? And in fact, we're seeing some of that in some south-south programs as well. So there are changes happening. At the same time that it's growing, we're seeing more and more of a critique. Some of you are familiar with the scholarly literature that critiques some of the problems that I've mentioned. More and more on social media, the Barbie Savior I have a picture from. Non-white, no white saviors is a site both on Twitter and Facebook, Instagram, all of these social media sites. We're seeing more and more of this sort of satire, but also very sharp critiques of people going from rich countries to poor countries thinking that they're going to somehow save people. And finally, we're seeing increasingly discussion about the need for decolonizing global health. We need to see this enterprise of global health trips, global health activities as part of a longer history of the North having colonized the South and having gained great benefits from that, and the power relationships that have endured and how they affect the quality and ethics of the global health enterprise. So that's a topic for a whole other talk. I just like this particular website, the No White Saviors, particularly the tagline. We never said no white people. Here's the important line. We just know you shouldn't be the hero of the story. And I think that's something for us folks, particularly in the global North and working with students, to remember that we're not the hero of the story. And it's tempting sometimes to want to feel that way, but cultural humility is a buzzword now that I think is a really important one for us to remember. So a third thing that's happened the last decade is that some organizations have taken these critiques very seriously and have begun to reevaluate their programs. Some have stopped doing them altogether. Others have reshaped them so that they would be more focused on preparing people in advance, sustainability, partnerships, ethical behavior, and overall quality. And I just mentioned a few here that some of you may be familiar with, but that's an important thing. In addition, another change that's happened is that many associations have begun to issue guidelines for how to do these activities well. And I mentioned a few of them that some colleagues and I reviewed for an article that was published in 2018, and I have references at the end. We found 27 published guidelines from all kinds of sources, and I mentioned here the American Dental Education Association was one of the pioneers here. And what we found in reviewing them was that there was a remarkable consensus on what would be best practices, often along the lines of the things I've been talking about, but none of them coming from host organizations and none of them talking about how to enforce these guidelines. So lots of recommendations, but there's actually no regulations, there's no laws, there's no enforcement mechanism that exists. So many organizations can continue to do what they've been doing with no accountability. Recently, since we published that article, other groups have, major medical health groups and I know the World Cleft Coalition have also published guidelines. So clearly the culture around this whole activity is changing as people are trying both individually and organizationally to come up with a better approach that is more effective, more ethical, and more valuable. We're seeing some host countries beginning to take action to control abuses. You may have read about the American woman who's been sued because she started a children's home and some children died there. I'm not commenting on the validity of the claims, but this is certainly one of the first times there's been a lawsuit against a visitor for harm done. For a while, Kenya banned all medical groups, and there have been a number of occurrences that have led host countries to say, hold on, we can't just let anybody come in because they want to. And this picture is from the airport in Kampala in Uganda. Putting travelers on notice that they can't just come in with drugs in their suitcases the way we have done in the past, that there are laws regulating the importation of drugs. And this was actually an old law, but it was not enforced, and now they were beginning to enforce it. So that's the fifth thing. Sixth thing, last, is the one I'm, of course, most involved in. It struck me in doing this work that all these different siloed sectors were thinking along similar lines, but hadn't necessarily talked to each other. And so a group of us with shared concerns came together in 2017 at a conference of the CUGH, Consortium of Universities for Global Health. And we brought together representatives from all these different silos to talk about the shared concerns and goals and to create what became the Advocacy for Global Health Partnerships organization. And that's the website, and I'm going to show it to you in a minute. So we had people from every field and all different sectors And it was a very exciting moment where people could say, oh, other people are thinking about these things too, and wanted to continue to do that. With the help of Habib, who's on this call, Habib Benzion, thank you. We applied for and were given a grant to have a conference at this beautiful Brochet Foundation in Geneva last May to talk about this and bring together global health leaders. Sadly, of course, it didn't happen. But we were able, through a lot of virtual calls and discussions, to create this Brochet Declaration, which was an effort to bring together a lot of what we had learned and into a statement of principles that we felt people involved in global health and sharing the same values would be able to support. So you can see the principles there. Very important emphasis on partnership. Again, you are not the hero here. This is a mutual association where each partner has something to give and each partner has something to learn. And with mutual partnerships with trust and a long-term relationship, it becomes more possible for the host country and the community to say, this is actually what we need, not the stuff you're bringing us, not the things you're doing, but here's what we need. And to create ongoing programs that meet those needs, but also are of value to the volunteers and the students. And that they should comply with all of the applicable laws and ethical standards. People should not be practicing outside their scope of practice or outside the laws that are applicable. I mentioned humility before, cultural sensitivity. These are things that are not easy for people to learn. You can't just give a course in it, but it is a very important goal to aspire to. And finally, some accountability, evaluation, research, more of that is needed. So I'm going to, if I can, show you this is the AGHP website. This is the page for there's more links, there's other pages, but this is the one for the Brochet Declaration. So it gives you the entire declaration, you can download it. And we have here the logos of organizations that have endorsed the declaration so far. We have about 30, and they come from all the different sectors, from small NGOs to large national alliances and international organizations. We're very excited about that. We've gotten fantastic response from some leading global health people, and including we've got some dentistry, oral health groups, and some other groups are reviewing it right now for support. So that is something I'm be happy to have those of you who are involved in oral health organizations locally or internationally. So I mentioned there were two challenges: to understand the problems, and I've tried to do that very quickly to review a lot of research material. And then the other part of the challenge was, what's next? Be prepared to reboot. If we're at a tipping point, what way are we tipping? And how do short-term programs fit into this picture? How can they contribute to improved health and education for all of us? Can they be integrated into longer-term sustainable and equitable partnerships? And that's, of course, again, the key thing. And can the Brochet Declaration contribute to this? So those are some questions. I came across this, I kind of like it. I thought it was a very interesting commentary about the need for, again, equitable mutual partnerships. I got the references here. I'm sure you'll be able to get the slides if you want to. I want to thank lots and lots of people who helped me and who worked on this project. the research teams in the countries, Lehigh University, it's been, as I said, very supportive. Many colleagues, in particular, Dr. Cohen, Dr. Benzion, who have been instrumental in helping me to understand better a lot of what's going on in the world of oral health, and who've been terrific leaders in that field. So I hope I haven't taken too much time. I tried to talk fast, and I welcome your questions and comments. Thank you.
Thanks, Judith. That's great. I'm going to be throwing out the questions for you.
Okay.
Here's one from Daniela Onofrio. What are 3 basic questions any student or faculty ready to participate in an international health mission trip should ask themselves?
Daniela, that's a great question. My first sort of gut response is, why am I doing this? But I have to say that over time, as I have thought about this and talked with a lot of people, my conclusion has been that the actual motivation is not as important as the organizational context that you go in. So a person who's going, and I will give you an example, one of the trips I went on was led by a young man who had gone on his first trip because the woman leading it was somebody he was really interested in. And he thought, he was a student, they were undergraduates, and he thought, oh, I'm going to go off to Ecuador with this hot young woman and maybe I'll have a chance at her. I guess it didn't work out, but he ended up being totally hooked and ended up in medical school and very involved in global health. So that's not the kind of motivation, but it worked out okay. For me, the important thing is not why are you doing it, but who are you going with? What is the organization that you are with? What are their goals? How much is this about their own reputation versus how much of it is for the benefit of everybody involved? Am I going to do something that I don't really have training for? Am I going to do something that a community has said that they actually really need? And is there a way that I can contribute to that? How would that be? For many students, I mean, I've had students who had absolutely no background, none, undergraduates, who came back from Dominican Republic after saying how much they had helped. And when we dug into it, no, they haven't really helped. I think the important thing is to think, okay, what can I learn from this? And how can I be humble in the process and be an engaged learner?
Thank
if somebody
you.
has skills, that's a different matter. Then how can I use my skills to benefit people in the way that they define as needed? That's a long answer, sorry.
That's okay. We just have a whole queue of them.
Okay.
Next from Marion Bergman. In your viewpoint, how can dental outreach best contribute to sustainability of oral health?
Great. And again, remember, I'm a sociologist, not a oral health person, and a lot of you can answer this question, I think, very well. If oral health is integrated into other kinds of health services, I think it's incredibly important as a part of an overall picture of how do you help people to lead healthier lives. So that means hygiene and water and having a healthy environment, and oral health is all very much part of this. But I do think that oral health has to be part of a more broad, comprehensive set of services because of all the ways that oral health contributes to overall health, and poor oral health can really be damaging overall health. So I think it's got to be integrated as much as possible into and it should be in this country, in the US, I ask, because in America, it needs to be integrated in America, where there are millions of people who do not get adequate oral health care, who can't see a dentist. And I think that's just inexcusable. And it has long-term effects on them in many, many ways. So I think it's really a disgrace, and that we need to, those of you who are Americans, I'm sure many of you are focusing on that as well. I think it needs to be done worldwide and starting for many of us at home.
Yes, Judith, actually, several people made comments, last questions about that, saying, how could we do this when we're not do this with these other countries when we're not even really being effective enough in our own country?
I absolutely agree. And for the students especially who want to do good, and bless them, they are highly motivated and thinking in a good way. Oftentimes I tell them they will have much more impact if they can find a way in their own communities where they're helping over time and not just going on a trip for a week and coming back again, as exciting and wonderful as that is.
Right. So a question from Gail Shupak, in view of things you've shared, her question was oral health oriented, but I'm going to tweak it a bit. So how do you see these global health missions? Do you see that they have any potential to promote peace and friendship among nations?
Wow, I think that's a question that your organization has struggled with very well. I honestly, that's a really good question, and I'm not sure I could answer it. The Peace Corps was founded in part because it was the Cold War and the American government wanted other countries to think well of the US by having all these idealistic young people visit and get to know them. And it actually has benefit for them, for good or for bad. I don't know. I think there's, that's, somebody else have an answer to that?
No problem. No problem. We all struggle with that one.
Yeah. What do you think, Deb? That's what your organization started with, right?
Yeah, yeah. That's why I am. Here's
comment?
another one. Oh, your sound is going in and out now. Can you hear me?
Yes.
Okay. Here's another one. In your viewpoint, from Michael Glick, is oral health a human right from your perspective?
Of course.
Okay.
I mean, I can expand on it. Yes, absolutely. I believe in the World Health Organization charter that says that people should have full social, physical, mental well-being, and that every one of us has the right to maximum possible well-being, and oral health is absolutely a central piece of that.
Here's one. Are there any areas of concern that are specific to oral health activities that you think that the Alliance could move in to develop some kind of program that may be helpful?
I think not
other than our basically trying to break down the silos that are obstacles.
Yeah, I think breaking down the silos is one. I think another one, and again, I don't know if it's up to the Alliance or to one of the organizations that some people on this call represent. Right now, with all the guidelines and principles, nobody is vetting programs. We don't know, and this is a question I get all the time from potential volunteers. How do I know which program to go on? And I can give them questions to ask and things to look for, but we do not have any system that I'm aware of, and I'd love to hear it if we do, where programs are reviewed and evaluated and not allowed to go or given some kind of, obstacles if they do not meet basic criteria for quality and ethics. There are such limitations, such oversight a little bit in a few other countries. This is not uniquely an American problem, but it's particularly one because we have such fragmentation. Anybody in almost any country can just say, I'm going to go to, Peru or Guatemala or Bangladesh, and I'm going to set up a clinic.
Yeah.
And if those countries are able to stop it, they have rules to do so, but it's often not easy to enforce. They don't always know who's coming in and doing what. So it's hard to enforce from the host end, but that's where it's going to have to happen. But
Deb, could I make a comment?
Yes.
Yeah,
I'm
so
sorry.
yeah, I just want to really thank Judith for this presentation, because I've spent a lot of years trying to figure out what she has just presented. I wish I had heard it 25 years ago.
Thank you.
So, I've done surgical missions now for about 25 years. And the early ones were actually in Ecuador and Mexico and Nepal. And we were guilty of most of the transgressions you alluded to. And then a colleague of mine and I started a mission in Lithuania where we tried to do a better job. And I just, if I don't want to be presumptuous, but just a couple of comments that crossed my mind as you were talking. One is, I think the importance of finding a champion in the country you're going to. Somebody who does have a long-term commitment to improving the health, at least in the area that you're going to, or the region that you're going to. Also, we would always stop at the Minister of Health and present our credentials and go back there every year, so that after a period of years, we were friends.
Yeah.
In terms of having some sort of broad impact, the president of Lithuania eventually invited us to his palace to provide recognition for the program. But it's only because we laid that groundwork with the Minister of Health every year. I think shared responsibility is really important. So we would never go there and say, gee, we're going to give you this, unless we said, but we need you to do that. We always indicated that we couldn't get this done if they didn't do stuff to help make it happen. So they truly were partners in what we did. You're right. There's usually local doctors who are actually very good at what we do. And so, we have to realize that what we're doing is taking care of the glut of non-paying patients that they can't take care of. It's not that they're not there. I think multidisciplinary is important. In terms of outcomes, we evolved to where we only did maybe 15, 20 cases in a week. And there was usually 4 or 5 surgeons. And the idea was totally around training. So we would go there for 2 weeks. Their doctors, nurses would come here for 2 weeks. So we could see how how things were different and how they were the same. And the goal was not to change the oral health directly. It was to not have to go there anymore.
Yeah.
So I think a really good outcome is to have a training orientation where the goal is that they don't need you anymore. And it took us 10 years, but we actually did get there. There's no reason for us to go to Lithuania other than to drink vodka with our friends. I think technology can be really important in sustainability, because you can actually go there with, Zoom or whatever kind of technology you use and evaluate patients when you're not there. You can actually go to the operating room with them and they can say, gee, should I cut at this level or that level? So there's huge opportunities for technology to make these sustainable, kind of programs. And I've read books about culture of different places and trying to prepare to go there, and they always fail me. But if you have your champion say, hey, something, follow me around for the first few years and don't let me screw up, you can learn a lot about the culture of the places and how to act and negotiate the political problems as well as the cultural ones. So anyway, I'm sorry to take up so much time, but so much of what you said resonates with me that I just felt like I needed to make a few comments.
I'm going to shift to, thank you, Jerry. We really appreciate your comments. It's a great practical example in the oral health arena. I'd like to shift to the chat because people are popping up there with all kinds of different things. We only have a few more minutes. Mahesh Verma, did you have a question? Mahesh, are you there? Unmute. Oh, okay.
Yes, Deb.
Great.
My question is that, this is a good practice in the North American and European dental schools that this volunteerism, is embedded, and it is expected that students go out to different place and learn and experience. But somehow, this is not happening in the rest of the world, and mostly, it is usually from rich to poor countries, and the reverse doesn't happen. I liked Judith's presentation, and she said there has been a survey of dental school in 2017 where 41%, I think students, they were desiring or they benefited from such exchanges. But I mean, was it a global survey, or was it just restricted to North American dental schools? So, if you really want to decolonize the global health, and we really want to popularize it, I think it has to be, it has to spread all across, and this should be part of most of the dental schools, because even here, we in India, we have a big number of dental schools, but it doesn't happen. It always remain within the school. And of course, we have public health activities which is linked to the school, and it doesn't happen otherwise, going into far-flung areas, or going to neighboring countries, or going to other setting, and gaining experiences. So that was just my point. Yeah.
Thanks, Mahesh. Rick, did you want to comment?
Deb, just want to say, yes, that study was from a U.S. perspective, but I do think we're seeing more and more people in countries, including India, from what I know, who are more and more interested in traveling to assist in global health. I think that we'll see more of that coming in the future.
Rick Rader had an interesting comment / question. Rick, are you still with us?
Yes, I am. Thank you. Can you hear me?
Would you like to comment?
Sorry?
Should I share it, or do you want to share it?
No, go ahead. Okay,
so do you have the same, this is interesting because it gets out of dentistry, but it pulls us across our silo. Do you have the same, because Rick is a physician, do you, Judith, have the same concerns relating to anthropology students going into areas to observe materials, participate and report on cultural differences? Or is it only in health?
Oh, no, it's way beyond health. I mean, I think there are concerns with any program that involves some kind of service model. So this is not referring to anthropology yet, but there are thousands, millions of volunteers who travel to do short-term programs in what is referred to as development. They do teaching, they do counting of turtles on the beaches. They do all kinds of programs in construction, in you name it. There are areas of volunteering that are being promoted around the world. They all, I think, have some of the same issues as the ones I talked about. When it's an anthropologist or a sociologist like myself who's not purporting to help, but mostly doing research, I think there's a separate set of ethical issues. It's also, and I am certainly guilty of it myself. I did my dissertation in West Africa many years ago, and I took up a lot of people's time answering my questions and helping me to understand the healthcare system. And, I built my career on it. And did I help any at all? Did I contribute at all? not much. So I think there's always ethical issues around doing social research that need to be addressed. Unfortunately, we have IRBs that look at those. Some people have suggested we need an IRB system for volunteering, for global health trips, for other kinds of trips. So an institutional review board, if you're going through a university or a hospital, a board that reviews what your plans are and has standards applied to them as far as, is this an okay thing to do? Or are you in any way jeopardizing the people that you're going to be spending time with? So I hope that answers that question.
Great, thank you. I'm so sorry. It's after 10 already, so we'll have to say our goodbyes. But I did check with Judith earlier, and since we were unable to get to all of your really thoughtful questions, she graciously agreed to answer by email anything that has not been addressed in the presentation today. And we're all very eager to continue in the discussion. Thank you so much, Judith, for sharing your body of work with us. It's such an important body of work, and it really enlightened us and raised our awareness of all these details that are going on out there. Even though many of us have been tangentially involved, it's very interesting to hear it as a complete, presentation. And I personally look forward to our next meeting of the Alliance for Oral Health Across Borders, where we will discuss our moving forward and signing the brochure declaration.
Fantastic.
Great. And I do hope that our organizations can continue moving forward and being close with each other, sharing opportunities together. So everyone, please, we are going to have 2 more think tanks this year, one in June and one in October. We'll be sending out information closer to that time, so I hope you can hop on with those in the future. If anyone has any questions regarding the Alliance for Oral Health Across Borders, just hop on our website and go to the Contact Me page, and we'll get right back to you. Of course, we would be highly appreciative if you would like to make a donation